is March 23rd, 2021. The time is 6:05. This meeting, it will be held in accordance with the Governor's Executive Order N2920 issued on March 17th, 2020 regarding the open meeting requirements of the Ralph M. Brown Act and the Federal Americans with Disabilities Act in an effort to help avoid the spread of COVID-19, to maximize transparency and provide public access to city council meetings. I want everyone to place your hand over your heart. Councilmember Hernandez, would you lead us in the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Before I continue with the agendized items, at this time, I just would like to say that the city of Riverbank is very saddened by the recent racial motivated crimes in Atlanta and throughout the United States, especially towards Asian, but towards any individual, whether it is ethnicity, orientation, or any of the other avenues. And I would at this time invite any council member who would like to address the city with their own thoughts to speak now.
Hi, Mayor. Thanks for those words. I'd like to just say my heart goes out to the families. I'd like to just say the names of those family members that were, that had to deal with this horrible incident. So those that were affected were Soon C. Park, Hyun J. Grant, Soon Cha Kim, Young A.U., Delana Ashley Young, Paul Andre Michaels, Yunji Tan, and Diu Feng. So my heart goes out to the families, and it's just a tragedy what we have to continue to see and go through.
This is Councilmember Barbara Martinez, and I would also like to say something. Our hearts will go out to the families that were affected in Oregon yesterday too. And we just can't wrap our hearts or our minds around what's going on with gun violence. So I would like to say something about that, and also to offer a moment of silence for all those that have been affected most recently. Thank you.
Thank you. Any other council member?
Yes, Councilmember Campbell. I'd just like to say I spent some time many years ago in Asia, and they were just great people. And I don't understand why what has happened is happening, but I do hope that we can prevent it in the future. And my heart goes out to the families that were in this particular situation. Thank you.
Yeah, I appreciate you providing space for this. And, past today and everything that we've seen during the pandemic and even before, I think I would encourage us to take some action steps in terms of how we can start preventing it and normalizing conversations of, what's going on with racism, learning ourselves where it comes from and the root causes of all of these, because specifically with the Asian American population, I think it's hard to understand the intricacies that happen with each culture. Something like model minority myth, I would encourage you to Google and to look into, and just doing what we can in conversations, stopping, comments in passing or jokes even from happening. And I think that is a good way to do our part. So yeah, I also offer my condolences to everything that's happened.
During these periods, a letter is sent out with my signature to the mayors of the cities that these happen in. And we'll be providing one to Boulder and one to Atlanta and one of the others, the smaller city. I've got the name of it right now, but we'll be sending one out tomorrow. So with that, Annabelle or Maricela, roll call, please.
Council Authority Member District 2, Rachel Hernandez.
Here.
District 3, Cal Campbell.
Here?
District 4, Darlene Barber Martinez.
Here.
Vice Mayor Chair Luis Uribe.
Here.
Mayor Chair Richard D. O'Brien.
Here. Agenda changes, there will be no agenda changes, even though we just had one, no additional ones. Conflict of interest, any council or authority member or staff who has a direct conflict of interest on any scheduled agenda item to be considered is to declare their conflict at this time. Seeing none, we'll move on to public comments. If anyone residents would like to join us to make comments now or any business item that we are about to consider, please refer to the last page of the agenda for the comment procedure. At this time, members of the public may comment on any item not appearing on the agenda and within the subject matter jurisdiction of the City Council LRA Board. Individual comments shall be limited to a maximum of 3 minutes. Under state law, matters presented during public comment period cannot be discussed or acted upon. Ms. Eller, are there any public comments?
Mayor, I do not see any raised hands for members of the public wishing to speak.
Okay, thank you. We'll move on to the consent calendar consisting of items 7.1, waive reading. Item 7.2, approval of March 9th, 2021 City Council and Local Redevelopment Authority minutes. Is there anyone wishing to pull an item or comment? Is there a motion to approve the consent items as presented?
Councilmember
make a
Barber
motion.
Martinez. Go ahead, Cal.
Councilmember Cal Campbell, I'll make a motion that we accept the consent calendar as is.
And I second.
We have a motion by Councilmember Cal Campbell and a second by Councilmember Barbara Martinez. Roll call, please.
Council Authority Member Hernandez,
Yes.
Campbell,
Yes?
Barber Martinez,
Yes.
Vice Mayor Chair Uribe,
Yes.
Mayor Chair O'Brien.
Yes.
Motion passes 5-0.
Item 8, consistent of item 8.1, public hearings, general plan amendment 01-0202. The applicant has requested that the city of Riverbank approve an amendment to the general plan that would prohibit tobacco smoking in common areas of multifamily zone properties. The amendment will impact future multifamily residential development in the R2 duplex residential and R3 multifamily residential zoning districts.
Good evening, Council. Our associate planner, Gabriel Salazar, there he is going to give the report on this item this evening, and we're excited because I think this is either his first or second time to council, so we're excited to have him handle this important item. You can take it away, Gabriel.
Thank you, Sean. Thank you, Mayor. Let me share the PowerPoint with everyone. Good evening, everyone. City Council. So yes, a second, please. The lights went out here in the conference room. Sorry about that. So yes, item 8.1, it's an application from the California Health Collaborative to a request for the city to implement a general plan amendment 01-2020. This organization is requesting a general plan amendment to establish a smoke-free policy, including tobacco and cannabis for multi-family complexes in the city of Riverbank. This will impact multifamily development in the R2 duplex residential and R3 multifamily residential zoning districts, and possibly planned development and specific plan projects as well as a downtown that includes multifamily housing. The initial application proposed smoke-free language for the common areas of new multifamily complexes citywide And then the applicant came back to us and let us know that they wanted to request a modification to their request, which was to include future and existing multifamily zone properties. This application is funded by the California Department of Public Health through a collaboration involving the Health Collaborative, Stanislaus County Health Services Agency, and the Health Education Council. Some of the application highlights. The applicant let us know that Stanislaus County has a 17% rate of tobacco consumption, which is higher than the state average of 12%. Some other application highlights, some statistics. The typical cost of cleaning and rehabilitating and refurbishing a residential unit where smoking was permitted exceeds $3,000 when compared to units where smoking is not allowed. The general plan amendment is consistent and compatible with the goals and the vast majority of general plan policies. The general plan amendment is in the public interest because it will work to address health and equity challenges in the community. This application is exempt from the general rule that CEQA applies only to projects that have the potential for causing significant environmental impacts. Some background, on January 19, 2021, with a 3-2 vote, the Planning Commission adopted resolution number 2021-01 to recommend prohibiting the smoking of tobacco and cannabis in the common areas of future multifamily housing properties citywide. The City Council is provided with 5 options. Number 1, prohibit smoking in the common areas of new complexes. Number 2, the common areas of new and existing complexes. Option number 3 is the common and indoor areas of apartments of new complexes. Option number 4 is the common and indoor areas of apartments of new and existing complexes. And option number 5 is to deny the request. Sorry. I did kind of like a survey on the zoning map to see what kind of properties would be impacted if it was applied to existing R2 and R3. And I found about over 300, again, this is just an estimate, lots or parcels that would be impacted if this general plan amendment was applied through existing and the future. So just want to provide that information as well. And the applicant, staff is here to answer any questions, and the applicant is also here to answer any questions as well and provide a brief presentation also. Thank you.
Are there any questions from the council?
This is Councilmember Barbara Martinez. I'd like to get clarification, definition on common areas. So can that be explained for everyone?
Okay. No problem. Thank you, Councilmember Martinez, for that question. So common areas would mean hallways, stairways, alcoves, sidewalks, parking lots, tot lots, things of that sort. So any areas where residents could engage with each other, those would be kind of known as the common areas.
Thank you.
Vice Mayor Uribe here. I'd actually like to see the applicant's presentation before I ask my questions, as they might be answered during the presentation.
Okay, so you want me to open the public hearing?
Actually, Mayor, this is Annabelle, I'm City Clerk. Actually, we have Katie Moose, who will be making another presentation first before we open the public hearing. Katie, are you there? Yeah.
Hi, yes, I'm here.
Go ahead and load your PowerPoint, please.
Okay. Can you see?
Yes.
Okay. Hi, I'm Katie. I'm with the California Health Collaborative. Thank you so much for having us today. I'm here to talk about smoke-free multifamily housing for the city of Riverbank. And just to be clear, what I'm referring to in this presentation today is smoke-free, meaning no smoking or vaping, and in multifamily housing, meaning both inside of the units and outside of the units in the common areas on balconies and patios. So imagine that you are a mother that is living in an apartment complex and your daughter has asthma. and your neighbor smokes and the smoke is getting into your unit, whether maybe through the vents, maybe it's coming in through the windows. And so you ask your neighbor to please stop, and they did stop, but then they started back up again a few days later. So what can you do if you're in this situation? Well, you could go to the owner of your building. And if the owner of your building has a policy themselves that the building is smoke-free and it's in the lease, then there is something that they can do. They can then go to the neighbor and follow up with them and get them to stop. If the owner does not have such a policy, there's really, the way things are, the status quo, the mother really has no rights or recourse to be able to do anything about her situation. Her doctor has told her it's very important to keep her daughter away from secondhand smoke. Aside from moving, there's not a lot that she can do. So then you might say, okay, well, let's go to all of the owners of multifamily housing in Riverbank and get them to adopt smoke-free policies and put those into their leases. But thinking about it from a perspective of an owner or manager, a lot of times they're really not going to feel like this is their responsibility or even their right to solve this problem for the mother. A lot of people think, secondhand smoke is just something that exists in the world that people just have to deal with. And as an owner of a building, why would it be their responsibility to protect this woman and her daughter from the neighbor's secondhand smoke? Also, adopting a policy like this it's a hassle and it costs money. You have to get signs and things posted around. And they might also be afraid of losing business to competitors who might still be allowing people to smoke and vape in their units. And so these are, some of the reasons why, they're very often not adopting these policies. On the other hand, we've seen in several other communities that they can be very appreciative of cities that are willing to take this on at the citywide level. It's going to save them a lot of money. So third-hand smoke costs thousands of dollars to remediate in units where people have been smoking. It sticks to walls and floors, sometimes even in ventilation systems need to be replaced. It saves them money in terms of the cigarette butts that are around their properties and having to pay to continuously pick all that trash up. It's going to save them money in terms of getting fire insurance discounts, and it's going to level the playing field. So all of the owners are playing by the same rules. And so you don't have that issue of being afraid of losing business. 84 other California cities and counties have already adopted smoke-free multifamily housing. And I've just highlighted 3 here that are a little smaller, more rural, kind of more similar to Riverbank. Another thing to keep in mind is that, over half of Riverbank's population is Hispanic Latino. And in that case, there can be some issues with them coming forward to their property owners or managers and complaining about neighbors' smoke because of the fear of retaliation having to do with their immigration status, right? So they might be afraid that that would eventually lead to immigration status questions coming up for them or for their family members. And there have been some local surveys that Health Education Council conducted with Hispanic Latino individuals in Spanish. And they did write about this in those surveys, several of them did. And so we can happy to share that local data with you. So some of the effects of secondhand smoke on children include asthma attacks, inner ear infections, and sudden infant death syndrome as well. And you can note that courts have heard cases on this issue, and they have decided that smokers are not a protected class of citizen, and they don't have a constitutional right to smoke. There is no constitutional right to smoke. So really this choice that you all are having to make tonight, it comes down to freedom and choice. It's the freedom of the individual to smoke in their home versus the freedom of the mother to raise her daughter in a home that is free from toxins in the air. So it's been pretty well established by now that smoke does in fact travel between units. There's been several research studies on this in complexes across the nation. There's quite a few articles on there about this issue, and it has been established. And 40,000 people in the United States die every year from exposure to secondhand smoke. And a lot of the times that exposure is happening inside of their homes. Note too that a policy like this doesn't have to include eviction, right? Nicotine is very addictive and we want to be understanding of that. So warning letters, maybe requiring the attendance to a quit class, or maybe even some small fines can be sufficient for a policy like this. Smoke-free multifamily housing is also going to help you meet state mandates under SB 1000, the Planning for Healthy Communities Act, which is a 2016 California law that is having some communities develop environmental justice elements for their general plans. So this is a map of Riverbank. You can find it online at calenviroscreen.com. And it shows that the little red square is showing that Riverbank does in fact have what the state calls disadvantaged communities as identified by the state, and will be required to adopt an environmental justice element into your general plan under SB 1000. And I believe you all already know this because developing an environmental justice element is actually part of your current strategic plan. What does all this have to do with smoke-free housing? Let me tell you. So these are the criteria under SB 1000 that your environmental justice element is going to have to address these 6 criteria. One of those is promoting safe and sanitary homes, and smoke-free multifamily housing qualifies you under that criteria. So it is meeting that criteria, smoke-free multifamily housing. So that's why we applied for a general plan amendment rather than an ordinance, because it's like killing 2 birds with 1 stone. If you put this into your general plan, we're also helping to meet the state mandates under SB 1000. So in conclusion, lower income people live in multifamily housing more than higher income people, right? And this is just another one of those reasons why, through no fault of their own, not their own health choices, they're nonetheless being impacted more. Their health is being impacted more than higher income individuals because they have to live in multi-unit housing. They don't have options not to. And when there's, it's allowed to smoke and vape, their children are then being impacted by it. And it's just another one of those reasons why you see those inequities between lower income and higher income individuals, even without looking at, the choices that they make. So the mother in this case could choose not to smoke. She could choose not to let anybody in her house, smoke or vape because her daughter has asthma. Nonetheless, her daughter is going to be impacted, and there's not a lot that she can do about it right now. A just society ensures that no one is exposed again and again to things that we know are harmful, no matter what your income is or where you live. If you do decide to move forward with something like this, just know that there's actually a lot of resources and help available to you right now. There are 3 nonprofits. One of them is mine. There's 2 other ones, plus the county health department. We are all being funded to provide support, training, resources, funding to cities in this area to move forward on smoke-free housing. We can purchase signs for building owners, for example. We can do trainings, offer quit classes, quit resources, Spanish and English language materials, etc. This is contact information for all of those agencies that I just referenced. And I just want to thank you so much for your time. And we're here to answer any questions if you have any. Thanks so much.
I'm opening it up for questions. First, did you conduct a survey in Riverbank?
My My organization didn't, but the Health Education Council conducted a survey of Stanislaus County. And I am of Hispanic Latino community specifically. And I believe she was going to send you some of those results. So hopefully that, and she can answer that question of how many were from Riverbank specifically.
Okay, I'm frozen.
Oh, am I frozen?
No, I was.
Oh, also,
I didn't hear what you said.
okay, the county department also conducted surveys as well in Stanislaus County. So there's been 2 surveys that have been conducted, and we can get that information to you.
Okay, in the apartment complex of affordable housing that is in Riverbank, which ones allow smoking in their units? None. Correct?
Through the HUD, there is a HUD rule that HUD housing is smoke-free. Yes.
Okay. All right, thank you. And then you're suggesting fines when you have low-income people who are in their homes or in their area of living, who, by the way, we opened 72 units up and had over 1,100 applicants, and all of them were greatly qualified to be in those units, and now you want to fine them if they smoke?
I wouldn't suggest fines. No, I wouldn't.
Okay, so what's the enforcement?
That would be up to you. I would suggest letters, classes, things like that.
Okay. All right. We are going to be doing a general plan, a new general plan, including social and environmental justice portions of it in the next couple of years. And I think this would be a good time to address it. Doing a general plan amendment right now is kind of disjointed in what we have, in my opinion, and I'll open it up for public hearing here shortly. But I haven't heard anything that is overwhelmingly going into a way that we should change multifamily for those that are not low income or affordable housing. And that would be up to the owner, because as I understand, smoking and vaping in common areas is allowable. I believe there is some restrictions, and I believe all of them are in place in Riverbank to prevent smoking and vaping within the living areas. Some of the statistics you gave, great statistics, but they need to be quantified. Most of the deaths of those who have secondhand smoke are from someone they're receiving the secondhand smoke from individual or individuals in their household that are using. Okay, that has to be explained. Yes, it does go through. Yes, it does aggravate. So I like very clear statistics, not a generalized statistic. So, but I want to thank you for your effort on that. Any other questions, Vice Mayor?
Yeah, thank you, Mayor. So you kind of touched on a couple of the things that I was going to ask, but yeah, so federally funded housing, they're already not allowed to smoke there. The rest, they can't go to their car. It's not, it's illegal to smoke in your car. And mind you, I am against secondhand, thirdhand smoke. If I was still living in an apartment, I wouldn't want to be sharing ventilation systems or outlets or crevices with somebody who was smoking cigarettes next door, especially now that I have a 2-year-old. But I'm just kind of struggling there with the enforcement as well. I mean, I don't want to use the word targeting, but it's the only word that kind of comes to mind is who are we targeting with the enforcement? If someone can kind of clarify that, what does that actually look like? And then what about a cannabis patient who needs it for like cancer treatment? Like, what are we supposed to say to them?
Okay, any other questions before I open it up for a public hearing?
This is Councilmember Barbara Martinez. You mentioned that, well, first of all, thank you for your presentation. And you mentioned that one of the outcomes would be that a person could attend a class. So how much funding is there out there for the classes, and how long would that funding last? I mean, everything, you know, is kind of like on a grant, I assume, something like that. So how long is the grant money gonna last?
Two of us have funding through 2024. The county will continue to receive funding. It's under the law that the counties have to continue to receive funding. So, but they don't always offer classes themselves, but rather can do presentations and referral to California Smokers Helpline or other quit lines and things like that. But right now through 2024, we do have the ability to have actual classes in person if we can get back to in person.
Hey, Councilmember Campbell, I'd like to say a few things. First of all, I agree with everything the mayor and the vice mayor said, but I'd like to talk a little bit more about enforcement, because if we make it and take it up, then we're going to be responsible for the enforcement, and that can be a big thing for us as a community. We don't really want to have our code officers running down every other day because somebody was smoking where they shouldn't. Secondly, I'm a landlord, and I really think that this is the responsibility of the landlord and the building owners. When the applicants come, they get the choice. It's a non-smoking or a smoking environment. I personally do not like smoking at all, but I'm very concerned about the rights of the landlords and the rental industry. I don't want to see them pushed certain ways. I would suggest too that we continue with education with existing buildings and landlords and try to tackle the problem in that way to eliminate it more. And I also agree with the mayor that we need to take this up further, you know, when we go to our strategic planning. And the medical cannabis is another thing that bothered me. State of California says you can smoke cannabis in your apartment or your house. Thing is, some people in apartments need to do that for medical reasons. So how do we help them if there's not a common area and they can't go do it in public? So that's another thing that bothers me also. Thank you.
Okay, Rachel, did you want to say something before I open it up?
It seems very complex. I guess one of the things that came to mind is maybe it being kind of regressive in terms of policy, but I mean, I agree that these effects, I mean, I believe that these effects and the science behind it. I guess what kind of, I'd be curious what kind of support throughout, if this is an issue, the nonprofits in the county would provide, and the same as everybody else with enforcement. How do you support existing cities that pass ordinances like this, and how can you support the city of Riverbank in this aspect?
Probably the most beneficial thing we can do is connect you with some really good organizations that are really versed in enforcement of a policy like this. So the Public Health Law Center and Change Lab Solutions, they both have like model policies with all the enforcement language, and you can connect with lawyers there and talk through everything. I honestly am not a super expert on the enforcement issue, but I know that some cities use zoning codes, and I know with social justice issues, you know, we agree we don't want police necessarily to be enforcing this. So can this be enforced through zoning code, or, you know, other ways? How do owners and managers enforce other policies like no pets and things like that? So those would be definitely some conversations and a big issue to tackle. Yeah.
One thing, Mayor, if I may, Katie provided a lot of excellent resources as she made her application and went through the process. And one of the things that she provided to me was some contact information of the city manager of Fireball, who I actually talked to today for a little bit to get an idea about practically if the council wanted to go this direction in some form, how does it work and what have the issues been? And he was pretty clear that they had a perspective that if there was a problem or a complaint of some kind, they would send a code enforcement officer to talk to the person or potentially cite them if they couldn't get compliance, but that they hadn't experienced any complaints so far. And that mostly what had happened was, if there were areas where people were smoking inside multifamily units or in common areas, those have just moved out to the to other designated areas that are not on the property. So to be candid, was sort of what he shared. I think from my perspective, the staff were tasked with enforcement. What would be difficult for us is it is commonly tricky to enforce code to folks that lease property, whether it be a renter of a piece or you're renting a house, because at the end of the day, if the fines or citations don't work, typically the hammer that we have is we place it as a lien on the property. And so in this particular instance, it might be kind of complicated to do that because you almost don't want to punish the property owner for, the issues of the tenants. So, at least my opinion is if council wanted to move forward, we would really just sort of depend on voluntary compliance here.
Okay. Sean, thank you. That's insightful. And thank you, Katie, for your presentation. How are you doing in banning tobacco and cannabis in California?
Don't know about banning it, but I think Californians are going to be soon voting on a policy that would get rid of flavored tobacco products. And I think that's going to end up being on the ballot if Governor Newsom gets the recall. I believe it's going to be on that ballot.
Okay. All right. No other, I'm going to open it for public hearing. Annabelle or Maricela, who's ever's out there. Is there any public comments? By the way, we've had at least three public comments through emails, correct?
Correct. Let me see here. Trying to get my panel. I do see one hand up, but before we do that, let me enter for the record. There were written comments in favor of this item received from Ephraim Lopez, a volunteer with the Health Education Council, and from Kamal Shand, president of the Young Adults Fighting Tobacco, and those were in favor of this item. I acknowledge receipt of their comments earlier today and immediately thereafter distributed the comments via email to each member of the council for consideration. After the 4 p.m. deadline, written comments were sent via email directly to each member of the city council from Talia Laster, project director, also signed by 3 other of her colleagues. And they are from the Saving Our Legacy project, African Americans for Smoke-Free Safe Places. And they were in favor of this item also. And we do have a hand up. Let me go ahead and get that. Hello, can you hear us?
I can hear you. Can you hear me all right?
Yes, please introduce yourself.
Good evening, council members and mayor. My name is Twyla Laster. I am the person who submitted the public comment. I apologize. We have been having issues with our internet connection. So if it got in after 4, please forgive us. Before I get started with my public comment, I wanted to address some of the questions that the city council members had, if I could, that my colleague was not able to address. Would that be appropriate, Mayor O'Brien?
This is a public, you have a total of 3 minutes and you're about into around 40 seconds.
Understood. Okay. Well, again, we can share best practices for enforcement across counties, working with enforcement officers. As your attorney had said, those enforcement officers and mandates for quit smoking classes is what HUD Housing did. And I was one of their counselors years ago when Sacramento was first considering the smoke-free properties. Free resources are available with free quitting replacement, nicotine replacement therapy indefinitely through the helpline. And we can also share that information. As far as statistics are concerned that are qualified and quantified that you mentioned that you needed, Councilmember O'Brien, we can definitely get those through to you with research so that you have all of the data that you need to make an informed decision for the general plan. And cannabis does not need to be smoked, which changes the molecular structure. Anytime that you place fire in your lungs, it's a detriment to further exacerbating the health disparities to that person. So it can be eaten or used as a topical applicant in order to assist with medical issues. So if you have any additional questions, not only Katie, but also the Health Education Council, the County of Stanislaus, and the Saving Our Legacy African Americans for Smoke-Free Safe Places are available to assist with any additional questions. Thank you for your time.
Thank you very much for your input. Any additional public comment?
Mayor, I want to share also that I did receive a phone call from Evelyn, who was concerned with the enforcement piece of if this general plan amendment would be adopted. So that's just a concern that I want to express from a resident, Evelyn.
Could you give us what she said, other than she made a comment?
She was concerned about the city telling residents what to do. She was concerned that it would impact the downtown, why the downtown was being specifically called out. I expressed that it applied to the R2, R3 zones within the area, within the city. So yeah, those are pretty much the gist of her comments, expressing a concern with the city implementing this new general plan amendment if it would be adopted, and in the enforcement piece, like I mentioned.
Thank you. Any other public comment?
There's no one else wishing to speak, Mayor.
Okay, I'm going to close public hearing. I'm going to bring it back for a motion to approve or whatever these council would like to do, or any additional discussion. Before we make a vote, we are going to look very closely at social and environmental justice coming on up in our new general plan. We're are looking at starting that within the year. Hopefully, we'll have some clarity in what the national and the state is doing towards the smoking. I have a concern about directing what is legal may not be appropriate. I was a smoker and nothing disgusts me more than smelling someone else's cigarette. But I find it difficult to tell someone what they can and cannot do, which is legal. Are we going to, I'm not going to go in anywhere else, but that's just my 2 cents worth. So I'm bringing it to the council. We have, can you bring up the 4 areas that we have to consider? Or do you want me to read them from my notes?
Vice Mayor Uribe here. I'll make a motion, Mayor, if you don't mind.
No, go please.
Yeah, so I'll make a motion for option, I believe it was 5, to deny the request for the time being, in anticipation of our strategic planning.
I'll second that motion.
Okay, then that is item E, echo, that we are denying the request. But we will consider it in earnest as we're doing our general plan.
Thank you, Mayor.
Okay. Annabelle, roll call, please.
Council members,
We have a motion by the Vice Mayor, second by Councilmember Campbell. Roll call, please.
yes. Council members, Barbara Martinez,
Yes.
Campbell,
Yes.
Hernandez,
I don't know if I'm able to clarify. Are we going to bring the same resolution back? Because I would like to consider it as is eventually again, if we are to postpone it.
We're not postponing it, Councilmember Hernandez. What we're doing is that we're picking it up as we do our general plan, which will be a new general plan. And in that, it will have two new segments. One will be social justice, which will consider this portion of it, as well as environmental justice as we move forward. This is not going to go away, but it's not going to be brought up as a resolution.
Right. Can I abstain for now? Can I abstain?
Yeah, you may. That is always an option. Yes, no, abstain, or recuse.
I'll abstain.
Okay.
Vice Mayor Uribe,
Yes.
Mayor O'Brien.
Yes.
Motion passes 4-0 with one abstention by Councilmember Hernandez.
Thank you. Thank you all. And thank you, Katie, and your group.
Thank you.
As we move forward, I hope you're engaged in our general plan as we start developing that in the next year or two.
Thank
Item
you.
9, workshops, Stanislaus Regional Homeless Strategic Plan.
Very much, Mayor. So as some of you know, or most of you know, City of Riverbank has been very involved, whether it be myself, the mayor, vice mayor, Councilmember Barbara Martinez, all the council have been very involved in the area and regional homeless strategy and programs. And it's something that we've been discussing a lot this year as we look to hopefully get a shelter, transitional shelter of some kind here in Riverbank. And just by chance, the Shaw and CSOC have started a process to create a regional homeless strategic plan, which addresses barriers, goals, and strategies to end homelessness across the county. So it's really intended to be a more comprehensive plan that doesn't just focus on some of these areas that have the highest concentrations of homeless people, but it really looks more holistically at our full system and making sure that we're serving all of the sub categories that are homeless in our community. And so this evening we have Nora from Home Base, who I have got the opportunity to work with for a number of years now, and she is going to lead us in a little discussion amongst the council which will hopefully help her as she puts together this plan. It's one of many stops. I think we're maybe the first or second of many stops she'll be making, on her tour around Stanislaus County. So I'll hand it over to you, Nora, and jump in whenever you need.
Great. Well, thank you so much for that introduction, Sean. And we're super grateful that you were willing to have us here. Thanks for that little description of the planning process. What we're really trying to do for this county-wide strategic planning process is make sure that we're reaching out to each city, each unincorporated area, to get feedback on what homelessness looks like and what are the challenges that are specific to your area. So I basically have three pretty broad questions that I'm going to throw out to the council and to members of the public if there are comments from the members of the public. But we also have a more comprehensive survey, which I know there's not a chat on this Zoom platform, but maybe I can have Annabelle and Sean circulate our survey after the meeting. It's just broader I think another thing we really want to focus on with the strategic planning process is how to make the homeless system of care more equitable and inclusive. There are a lot of questions that go to that as well on the survey, and we have it available in English and Spanish. So far we have had about 415 responses total, and I think 21 are from Riverbank. So if we can get that representation up from the Riverbank folks, that would be great. So any questions before I get started with my question?
Were you addressing the Survey Monkey?
Yes, yeah, I think maybe
Okay,
Sean.
that's in the staff report, and every one of us has looked at it.
Got it, perfect. Great, so any other questions before I kick off?
No.
Okay. So starting very broadly, what do you think are the biggest causes of homelessness here in Riverbank?
There's a variety of reasons. Divorce, there is loss of jobs, there is raising of rents, there are drugs, alcohol involved. There are, for children, disagreement with parents, and there's a whole variety. There is no one single issue for homelessness. Did I get any right?
I think you got it. I think that's a great answer. What else do we got?
This is a group meeting.
I think the mayor, the vice mayor Uribe here, I think the mayor kind of covered most of them. Even the ones that we don't physically see out, the ones that are going from house to house, the couch surfing ones. I think the drug abuse one does stand out. And I don't see. It's a little bit of everything, is what I would say. And I've spoken to a majority of our homeless in person. Not so much now because of COVID, but I would say that a little mental illness and drug abuse would be the top two there.
I'm sorry, you cut out for me a little bit. Would you ask what the results or the homelessness? What was that?
Yeah, so what are the biggest causes of homelessness? And I think we're particularly interested in hearing what are the causes that maybe are particular to your area, to Riverbank.
I feel that it's obviously not one size fits all, but I think generally it's lack of housing, the cost of living in general, the lack of support and resources.
This is Councilmember Barbara Martinez. I think that there are some folks that just like to be rules and regulations free. They don't want to conform to any particular, like I'm saying, rules and regulations. They prefer to be free. They prefer to just do their own thing, as they would say. So I think that there are some folks that are like that, according to some of the conversations that I have had.
This is Councilmember Campbell. I agree with everything that my colleagues have said. All those things are what happened with them, and hopefully we can find ways to make it better.
Got it. And anyone else want to comment before I move to the next question? Okay. So given that these are the causes that you're seeing in your area, what do you think are the biggest barriers to solving those problems?
Well, I have several. We want to start programs for this region, this area of Stanislaus County. And we've been looking for the last 6 years. And every time we get close to Shaw or some of the others, where, well, we're not going to give you money, but to start your program, but we'll give it to another city. And I won't mention the cities that or to the south, around 99, that get funding, but they have no plan. We have a plan. We truly have a plan, and we would like to execute that plan. And I'm willing to commit, with the council's approval, our general fund surplus to get this program up, if I can get reimbursed, or we can get reimbursed as we move forward. I'd like to do a host house type of program that would get several people off the streets in this area. Won't get them all, as Councilmember Barbara Martinez knows, that we have this one individual who has been homeless for almost 35 years, will not come in, and he states he likes where he lives, but he does. So those are what we can capture some. We have a lot of couch surfers, a lot more than what we have in the visible homeless, that we want to get into affordable housing. And we're doing that. We're going to build affordable housing for in several areas. Single family homes. We're also into additional multifamily units or housing units. So we have a broad plan that selectively targets certain groups along the way. What we need as a city is funding to get the chronic homeless identified and into a host house type, get them educated, and then follow on housing. As you know, of course, you know we're the city of action, correct? Shake your head, yes. Okay, and we have a lot of employment opportunities coming on up. We would be a perfect to go from street to education to transition into employment. And that will be happening within the next 18 months. But we're going to be left out in the cold if we don't get that funding to start the education process. And that is, to me, and everyone has been involved except for Rachel, she's new, but has been involved in our mayor's. I have a mayor's conference, basically, with all the nonprofits every year except for this year, where we talk about it. We have nonprofits, we have churches, we have food banks that are willing to help us support this program, but we have nothing from the county. What can you give us?
Can I ask you one follow-up question?
Sure.
So what do you think, how do you think the county, the CSOC, the SHAW, some of these bodies that make up the homeless system of care, how could they better take into account the needs and perspectives of Riverbank as a city?
I'm going to give that to the vice mayor because he has been frustrated. Or Rachel, are you now who is the current member?
Councilmember Martinez.
Okay, Martin. So either you, Vice Mayor, or Councilmember Martinez, want to respond to that, because I know my flavor on it is probably not as accurate as yours.
Vice Mayor Rivera, I think the short answer is we just kind of been overlooked. We've tried. And the biggest barrier is just the lack of funding. We're just not getting it. Where we can get that professional help, where we can get all the wraparound services. Right now, we're kind of focused on the outreach from the county, but that only goes so far. I think Councilmember Barbara Martinez is right. Some of our homeless population that there are people we have to take care of them, but some just don't. They just don't want the help. Most of the homeless that I've talked to in person, they just want less restrictive, low barrier, so they can stay with their pets, their partners, and their possessions, and that's what they're looking for. But the biggest barriers is the funding. It does come down to funding.
Got it. And so,
to go on what the Vice Mayor said, low barrier shelters, I'm concerned about if we try to establish one in Riverbank. Not on the items of personal possessions, more along the lines of abuse, weapons. A low barrier shelter does not preclude personal items from being in their possession, and some of it can be dangerous, whether it's drugs, alcohol, or others. And I know there hasn't been any problems, but I do not want to have a liability issue with the city of Riverbank for a low barrier shelter. That's my opinion. There's 4 other members who probably have a different opinion than I do.
Thank you, Mayor. And just for clarification, I was just kind of stating what I've heard from our homeless population. My opinion, and I'm still on board with you, Mayor. We still need to work towards that workforce development, that transitional housing, similar to Host House. When I toured it a few years back, what they're doing over there is absolutely amazing. I think for Riverbank, though, I think it does need to be scaled down just a bit. And just understanding, it's a two-way street. Our homeless population have to meet us halfway there. But we do need professional help. We absolutely do.
Yes.
Got it. So I'm hearing the biggest issues as funding, being overlooked for funding, and then also that there's, can be treatment resistance or resistance for participation for folks who are experiencing homelessness. Is there anything else that anyone wants to add to that list in terms of barriers to addressing homelessness?
Yeah, this is Councilmember Barbara Martinez. So we just recently, like within the last 6 months, I believe it is, just started having the county come out to assist with services. And the services are very minimum. I mean, I appreciate them coming out, but they come out on the 3rd Friday of each month. And, so what are the folks that need services? What are they supposed to do for the other days of the month? And they, something tragic comes up or something, they're in a crisis and there's nowhere for them to go to or nobody for them to talk to, to actually to reach out and to help. I mean, I know that there are resources, but they're not here for them to access those resources. And so, we just need to have wraparound services that are not just like what they've been doing for them is helping them to get their IDs or helping them to get a Social Security card, or, we've only had maybe 1, maybe 2 people that have gone into some type of housing. But, out of the number of folks that we have that need help, that, 1 or 2, yeah, that's a success for us to celebrate, but there's still a lot more I think that can be done.
Got it.
Okay, this is Councilmember Cal Campbell, and I'd just like to make a comment or two. The mayor said that we're going to be opening up several jobs, many jobs in the next 18 months. Likewise, Riverbank's starting to have a growing spurt. We're going to be dedicating Crossroads West later this week, and there's going to be a lot of homes there. Our population is going to do nothing but increase very drastically in the next 10 years. We need to have these facilities so that we can handle the additional problems that population growth is going to bring us in these areas also. So I agree with everything the mayor has said and the vice mayor and the rest of the council, but we need to have the money to put our facility in place so we can help people now and people of the future.
And I would like to acknowledge what Councilmember Barbara Martinez just stated and piggyback upon what she has stated, that we really I don't understand why Patterson, who's a smaller city, has county services. Oakdale, a smaller city than Riverbank, has county services. Riverbank has a backhanded county service. I'm not condemning the county on it, but it is kind of like a backhand. Oh yeah, we'll give you something because you've been asking for it. And we've been asking in earnest for 6 years. very pointedly since Shaw stood up. And every time well, no, you're not going to get it. We'll give it to someone who's unprepared to even do anything with it. And I'm not pointing anything towards any individual, you or the county. I just think that we need to come to a, as you say, a strategic plan. Does Riverbank need to continue bugging the county, or does the county have a plan that will take care of problems and bring it away from Riverbank as we move forward in where we're developing? Again, Darlene, that was a very good point, and I want to thank you on that. And go ahead, take it from there.
Got it. Well, thank you for that feedback. That's really helpful for us to know and for us to consider as we put together the plan. So one last question, and I think it fits well here since we've been talking about one concern being a lack of funding. If Riverbank had access to funding that was relatively unrestricted, so you could use it for any number of things to address homelessness, what would you recommend it be used for?
I got this one. Okay, I've been doing this now for a long time. If I had $2.7 million, I would build, the city would build a facility kind of like Host House, and then follow on housing after they graduate from that. At the same time, David Wright and Opportunity Stanislaus can help with the training for employment. We have retail, a lot of retail about ready to develop. We have other industries, although probably some of them aren't conducive for those who have been homeless, but they deal with the cannabis world. And there are rules, regulations, and boundaries that they would have to look at. At the same time, though, we have a lot of jobs that will be going out at the industrial complex in the next probably 12 to 18 months. So we have, what we look at is a housing job ratio, and we need to fill a lot of the jobs, especially in the retail business. And all of that can be done. So if I can get for the city, a transitional housing with education, a follow-on housing with approximately 12 months of housing available to them. And as they are employed, they'll pay a portion of it into their housing, and then they transition out, whether it's into affordable housing that we are developing or have, or into the mainstream. But we truly want to see that happening. Now, if you gave me unrestricted funds, oh heck, I could have this city with this council approve a great area for this region. I see the funding going out. I do not see the programs other than Patterson that are capitalizing on education and training. I see a lot of warehousing, and I do not like warehousing. I'm not going to warehouse homeless, and I'm not going to build warehousing for commercial development. I want to see training, education, and results. That's my vision, and that has been with all of the council members as we do this annual retreat. And that's the same thing that all the nonprofits, the food banks, the churches all have the same vision, but we just can't seem to break out of a Riverbank barrier to the funding.
Well, it sounds like you're ready to go.
We
Like
have been
that.
ready to go.
Yes, great, good to know. Thank you. That was great feedback. Anyone have other elements they want to add?
I do. I want to make sure all the council have spoken. This is something that I've been doing for a long time, but I'm sure there's other council members that have greater ideas than what I have.
I think that was well said, Mayor. I'll just second your comment.
I think that I agree with the housing. I feel like what we're seeing with homelessness, now that we're in a crisis, is that we're at the extreme end of what can happen with, you know, broken systems and inequitable systems. So housing first is always priority for me. In going into permanent supportive housing for those that aren't able to kind of get on their own feet, and wraparound services, like everyone said.
This is Councilmember Barbara Martinez again. Yeah, I just really think that the services are so very, very important and key, because you can't just take a person and put them in a home and think that they will be able to budget. If they've been homeless for a while, they need to know, you know, they need to have training so they understand, you know, you got to go on a budget, how to get your budget together, understand what your finances will be. You can't just put a person, like I say, in a home, even for a job. Some people have not had work in years, and to no fault of their own, but there needs to be training on how, you know, what expectations are when you have a job. You know, you got to get there on time. You have to see a project through, you know, all those kinds of things. And, you know, I just think that services are just so ultimately important. Thank you.
Sean, do you have any comments? You've been involved with this at a greater detail than I have been.
I do have a comment. I was speaking with one of the council today, this afternoon, at length about this. And I think that I'm going to try to say this in a way that I think is respectful, but hopefully is also constructive. I think that from a countywide perspective, as we look at all of the different service providers that exist here regionally, that we can't be afraid to readjust or completely change the models that we're thinking in. That I think that if there's any issue that is apparent, at least during my experience, is that where we seem to not be cohesive is that the variety of services that we have already and are funded already aren't braided together in a way that is efficient. And so the fact that Chief and I have spoken about it a number of times just recently, where we'll have people that actually want to make that step and move on to supportive housing or shelter or whatever, and they get lost in the cracks sometimes because of sometimes it's bureaucracy, sometimes it's internal rules, and that's a real shame for a small town like Riverbank, who, you know, we may not have quite as many homeless people as some other communities in the county, but that makes it even more significant for Riverbank when it happens, because it's a greater proportion of our homeless that are falling through the cracks. And so that's just my general comment is, I think that, you know, we have sort of a messy system of care right now. And I don't mean that negatively. I just mean that there's a lot of different variety out there. And I think we could be better coordinated as a whole, especially when you think about the variety of services from youth and at-risk youth and a number of the other subcategories of people that need specialized kinds of care. I just think that we have to be, you know, bold enough to rethink our strategy if we decide at some point that it's not really working. And so that's just my general comment.
Appreciate that, Sean. Is there any final comments from the council? Okay, those are all the questions I have. So I would defer to the council on any procedures around opening it up to public comment. But that's all that we have. And again, we really just thank you for allowing us to come in and take up your precious city council time. So we appreciate it.
Did you expect the amount of detail that you got?
I'm delighted by the amount of detail that we got. I really appreciate it because I think it just depends. It can vary, right? And how involved the city council is on this issue and how much this issue is affecting a particular city. And so it was really helpful to get, the more specific the feedback is, the more helpful that is for us and the more that we can pass that on and capture that in the plan. So
Okay, I want you to understand that this council is probably the best in the region. I can say that it's going to be the best within the 9 cities, but we have raised a lot of concerns, and we have not been. Maybe you could help us with our strategy on how to accomplish what we need to do as a city for homeless, and I think it would be appreciated by each of the members.
Yeah, and I definitely think that is something that can be pushed forward as part of this process. So, and I think our contact email is also in the agenda. So I'm happy to answer any questions or think of ways that your city could leverage this process for the benefit of the council.
And we will be using it. Thank you. Annabelle, are there any public comments?
Mayor, I do have a hand up, and that is Brad Hahn. Hello, Brad, can you hear us?
Yes, can you hear me?
Yes, go ahead, please.
It's kind of fun to be a fly on the wall and listen to comments that regarding this subject. And I can't agree more with everything that was said, honestly. I think that Sean really hit it on the head with us as a community not working together, because in fact, I think sometimes the funding forces us to isolate and go into silos. But I can tell you, I give you my promise that I will work diligently to try and get the Shaw to where we're able to do exactly what you guys are talking about. In fact, we are working diligently to get the host house model in Riverbank, and we've ran it up the flagpole with the ESG money that came, that $22.7 million, and it's questionable about the construction. So we found another source, the HAP money, that looks like it'll work. And there's all of the NOFA, the notice of funding availability, will be coming out through the county. And we do have $8 million earmarked for host house type, not only construction, but the actual operations of it for the next few years. So I'm glad that I was able to hear the passion, and it gives me more desire to continue on with fixing this whole thing countywide. Thank you.
Brad, I want to thank you. Had I known you were listening, I probably would have toned down a little bit, because I know how much you have been involved with the Riverbank, and I appreciate you're working with us, and where we can go in the future. We just need the funding now.
Yeah.
You know, we have the passion. You know that we have the direction and the desire. Just let us know what we can do to help you too.
Yeah, we're gonna get it done. That's for sure. Just, it's a lot of boxes to check when you're working with the federal government on things, but we're gonna do it.
Thank you. Annabelle, are there any other public comments?
Mayor, there is no one else wishing to speak, and there were no written comments received on this item.
Okay. Well, Nora, thank you very much. I hope we gave you what you were looking for. And before I say we're going to move on to the next item, are there any alibis from the council? Hearing none, then we're going to move on. And Nora, again, thank you very much.
Thanks so much. Take care, everybody.
You too. Okay. We're now moving on to item 10.1, 2020 General Plan and Housing Element Annual Progress Report. A resolution adopting the 2020 General Plan and Housing Element Annual Progress Report and authorizing staff to submit said reports to the California Office of Planning and Research and California Department of Housing and Community Development. Sean?
Mayor, this is a statutory requirement that we believe we're required to do every year. And our associate planner Gabriel is going to be taking this one as well. So take it away.
Hello, everyone again. Let me just bear with me a moment so I could share the PowerPoint. Okay, this is the 2020 Annual General Plan and Housing Element Report. This is required by the state of California that we provide an annual progress report by April 1st. This highlights the progress on the regional housing need allocation. It also highlights the actions implemented on behalf of the city towards the general plan housing element programs. And this information is also used for grant funding purposes. The background, this council approved report is submitted to the California Office of Planning and Research and the California Department of Housing and Community Development. The city did win an award for SB Grant 2, where the city received $160,000 for services associated with a consultant to update the accessory dwelling unit ordinance and allow staff to work with consultant to develop counter handouts, have draft design guidelines, and conduct a fee study for potentially using for tiny homes. Also, as part of this grant, city is working with the county as well and other cities to create fully engineered ADU plan sets to provide free to our citizens. The city was also fortunate and lucky to win the LEAP grant. The city was awarded a LEAP grant in the amount of $150,000, which allows the city to upgrade the permit software system and streamline the process to make it easier for applicants and developers working with the city. The progress report highlights indicated that we have a 10% of the very low income goal has been reached, 14% of the low income goal has been reached, 0% of the moderate income goal has been reached, 27% of the above moderate income goal has been reached. And these were developed in the regional housing needs allocation that was developed for the county, covering the area, I believe, from 2018 to 2023. In 2020, the city issued 25 building permits, mostly for the California Estates and Countryside 1. This is an increase from 2019, where 18 building permits were issued for new housing. And just to highlight also as well that the city plans to see hopefully more new building permits for the year of 2021, as we received the tentative map application for an 18-unit subdivision at the end of last year. We also received a subdivision application tentative map for Countryside 3, which is for 25 single-family units. And staff also this year has received final maps, which is kind of the prior process before they need to get approved by city council, of course, but the final tentative, first is the tentative map, and then it's the final map. And we received an application for Bruin Heights, which is for 51 units. So hopefully you'll be seeing those final maps soon in city council, and that would lead to more single family unit development in the city. Some other general plan highlights. As you know, the Program Land 3 section grants, Program Land 5 section zoning amendments. And this is specific to the housing element, or like we mentioned, Program 2.1C accessory dwelling units, Program 2.1G, transitional and supportive housing. And this is kind of related to the grant where it could be used for these kind of purposes. And I'm speaking to regarding the SB2 grant. And staff's here to answer any questions as well.
Are there any questions?
This is Councilmember Barbara Martinez. Have we had any applications for the tiny homes?
Not yet. We're still working that out with the consultant to develop the ADU guidelines and develop conceptual plans. So as of now, not yet.
Is Brad Hahn still there?
I'm sorry?
No,
I'm asking, is Brad Hahn still there?
no, Mayor, it looks like he logged off.
Okay. Darlene, Councilmember Barbara Martinez, Brad has been involved in developing not the small home, the tiny home, but he's been doing some of the similar items, especially containerized homes that will be, if approved, a small development for transitional housing that can, or housing for the homeless, as well as transitional housing, and also for offices that can provide services from the county. So not having specific inquiries, but there are specific plans for it in the future. If that answers your question.
Thank you.
Okay, no other questions? Annabelle, are there any public comments on item 10.2, 10.1?
There is no one wishing to speak on this item, and there were no written comments received.
Thank you very much. I bring it back to the council. Is there any motion to approve the resolution as presented?
Vice Mayor Uribe here. I'll make a motion to approve item 10.1 as presented.
Councilmember Barbara Martinez, I second.
Okay, we have a motion to approve by the vice mayor and a second by Councilmember Darlene Barbara Martinez. Roll call, please.
Council members Barbara Martinez,
Yes.
Campbell,
Yes,
Hernandez,
Yes.
Vice Mayor Uribe,
Yes.
Mayor O'Brien.
Yes,
Motion passes 5-0.
thank you very
Thank you.
much. Item 10.2, certificate of correction, Crawford Road name change. The project consists of a proposed name change for Crawford Road between Oakdale Road to the west and Roselle Avenue to the east. A resolution changing the name of Crawford Road to Westgate Drive from Oakdale Road east to Roselle Avenue, and authorizing the city engineer to record a certificate of correction with Stanislaus County. Sean.
This item is going to be presented this evening by Donna Kenny. This is a sort of a cleanup item, I suppose, to sort of coordinate the Crossroads West project, but she'll explain the reasoning for it.
Welcome, Donna.
Good evening. Good evening, council. Can everybody hear me okay?
No, we all can hear you. Yes, we can.
Okay. So as you mentioned, this is the Crawford Road Certificate of Correction. So as an approved tentative map comes through our final map process, it's on the final map that the developer suggests street names for the subdivision. Before these names can be placed on the final map, we do submit the proposed names to 19 agencies in Stanislaus County, including 911 and the fire department, some of the ambulance services. So they're all checked and reviewed, and we wait for their approval before we let the developer know whether or not they can use those names. So street names that are same or similar to the street names that are close by to the project, for safety reasons, those are rejected. When an emergency is happening, we don't want the fire department to go to the wrong street or the ambulance to go down the street to the wrong end of it. We need people there right when the emergency is happening. So the name Westgate Drive was submitted to replace Crawford through the Crossroads West Unit 1 subdivision that is moving through the process and will be at your April meeting. When we submit those names to 911, this is the type of list that we get back from them. So they take a look at the different names that have been submitted and let us know yes or no, are those able to be used or not. And then when we came to Westgate Drive, they weren't opposed to changing the name, but they want Crawford Road from Oakdale Road to Roselle changed to match Westgate to make it easier for emergency services to find. Crawford Road, as you know, through the specific plan area of Crossroads West would be blocked or stopped, dead-ended at the city limits there. There will be a gate that emergency services will have a key to and be able to get through. But another aspect of it, let me go ahead and change this up. So here's an aerial of Crawford Road right now. On the far right, you can
Anna?
see Roselle.
I'm not seeing a PowerPoint.
Yeah, we don't see your PowerPoint.
Can you share, please?
I thought, okay, I'm sorry. Let me,
Most little kids were taught how to share.
well, let me go back then because it's showing on mine. Let's see here. Let's get it closed and try again. Okay. All right, so share screen, and here's my screen 2. And I hit share. Do you see it now?
Yes,
Yes,
Okay.
we do.
Okay.
there it
Well,
is.
sorry about that. Let me go back through here. Okay, so this is the street name approval list I was looking at that shows that they had some concerns with Westgate, but not if another portion of Crawford Road was changed. And here's my aerial. So over here on the far right where the green is, you can see Roselle Avenue, and then we travel west to Oakdale Road. Then as Crawford comes through the specific plan area, right at city limits here is where the Crawford Road will be blocked with a gate. This came about as, you know, through the approval process where these ranchettes over here were very concerned with the housing and the commercial area, increasing the traffic in front of their homes. So in the future, this road is expected to move north, and basically a new road would eventually be created in the future across these folks' basically their backyards instead of their front yards. So if this portion of the road in front of the ranchette stays Crawford Road, then this branch here that would come through their backyards would could not be named Crawford. So it cannot be a continuation of the Crawford Road as we know it now. So then from this point here through the project and then all the way to Oakdale, or excuse me, to Roselle is what the 911 has suggested that it all be changed to Westgate. Oops. So the recommendation is to either authorize the city engineer to prepare and record that certificate of correction, which will change the name of the street from to Westgate from Oakdale to Roselle, or to deny the request. And I'd be happy to answer any other questions or go back over some of my slides if you need that.
Donna, how did you guys come up with the name?
The developer suggested Westgate.
The developer for
The
east
F,
of Oakdale Road or the west of Oakdale Road?
west of Oakdale Road.
Hmm.
It's the Crossroads Unit 1 final map that will be coming to you at the next council meeting.
Now, my next comment is tongue in cheek, but there's other inputs that really could have driven home what is appropriate. I think something like Council Drive would have been great.
I was
There's
thinking Staff Boulevard.
Staff Boulevard is good. Planning Unit Drive. I mean, there's a lot of things.
There we go.
I'm not going to suggest that we open a debate on it, but when we start this process, let's do a debate before we bring it for final approval
Okay.
in the future. Okay, are there any council comments? I'm sorry, I didn't make light of the situation because it does have to be changed.
This is Councilmember Barbara Martinez. I just have a question. So once we approve the certificate of correction of the name change, how long does it take for that information to get out to like 911 or, emergency services, even for the GPS systems? How long does it take for all of that to take effect, or do you have any idea?
We would notify them tomorrow about the name change. I'm thinking they would ask for a resolution showing that change, but they may not. And then it's just a matter of the city replacing the signage. There are no businesses or houses that face Crawford Road right now, so no one would have to change checks or change their stationery, for example.
Thank you, Donna.
You're welcome.
Mayor, you are muted.
I hate doing that to myself. Thank you, Darlene. If there are any other comments? Annabelle, are there any public comments?
Mayor, there is no one wishing to speak, and there were no written comments received on this item.
Thank you. I bring it back to the council for a motion.
This is
Now you have two motions. One is to authorize the city engineer to prepare and record a certificate of correction or deny the request to change Crawford Road to Westgate Drive. Is there a motion?
Yes, this is Councilmember Barbara Martinez, and I make a motion that we approve the certificate of correction to change the road from Crawford Road to, what is it? Westgate?
Westgate Drive.
Westgate Drive, Council Drive, whatever you want to call it.
Okay, how about Westgate and the council? No, Westgate Drive. Thank you.
I'm sorry I did that.
Councilmember Hernandez, I second.
All right, we have a motion by Councilmember Darlene Barbara Martinez and second by Councilmember Hernandez. Roll call, please.
Councilmembers Barbara Martinez,
Yes.
Campbell,
Yes.
Hernandez,
Yes.
Vice Mayor Uribe,
Yes.
Mayor O'Brien.
Yes,
Motion passes 5-0.
Thank you.
thank you. Thank you all. Donna, thank you. Item 10.3, utility billing discussion and feedback. Maricela.
Thank you, Mayor. Yep, Maricela is going to handle this item yet again. I think this is number 4 or 5 that we've done it. So take it away, Maricela.
Yes, this, as Sean mentioned, this is an item that the city council has considered in the past. I'm just going to share a brief little presentation for you so that you can see all of the options that we are presenting for your consideration tonight. As you are well aware, we are still in the throes of the pandemic. While we are seeing improvements, primarily due to the surge in the vaccine having been rolled out, we still have some economic impacts that our residents are suffering from. And so the city council over the course of the past year has taken great strides to assist our residents to the extent possible, and including the authorization of the nonprofit grant program that provided some of our local nonprofits with funding to be able to assist our residents with help with their utility bills, including water and sewer. So the discussion tonight would be whether we would want to continue to waive the penalties as we have over the past year for delinquent accounts. So the governor's executive order from March of 2020 is still in effect, which states that municipalities cannot discontinue water service for those accounts that are currently delinquent. And so for this, the rest of this fiscal year, we still have 2 billings that we would be able to apply penalties to or waive should the council decide. That would be the upcoming March 31st, 2021 billing that's due. Typically what we would do for that billing is that the bill would be due on the 31st and then penalties applied on the 1st of April. We also have the June 1st billing, which is due, and that's due to the fact that May 31st is Memorial Day. And so we would always give our residents the business day after in order to come in and make their payment on the May bill. And so we would apply penalties on June 2nd. So that would be status quo, to continue with our normal practices as per our ordinance to apply penalties on the day after that our billings are due. The second option would be to simply delay the due date. So rather than have those due at the end of the month, we would provide all of our residents with an additional 15 days in order to make their payment without any penalty. And then on the 16th day of the month, we would apply the penalties. And the penalty would be 10% of the bill that is due at that time. So I do want to make that clear that we would not be applying penalties to any delinquent bills that were prior to the billing date. So for example, for the March billing, anything that was outstanding as of February 28th, we would not apply penalties to that. We would only apply penalties to the amount that was billed in March. And the same for the May billing. The third option that we're presenting is to not apply penalties at all, which is what the city council has done over the course of the past year. So for the March 31st and the June 1st bills that are due, we would not apply any penalties at all. So we do want to make council aware that there is a financial impact to that. So for the current fiscal year, since we have not applied any penalties, we have not collected any penalty revenue. That would be the case for these 2 billings should council decide that we would not apply penalties. The impact would be approximately $60,000 to the sewer and water funds combined. And I do want to make clear that your penalty fees that are charged actually go to fund your utility rate assistance program. Now, we do have the benefit that for the first 2 years of our rate assistance program, the program was not very active and we did not have a lot of residents who applied. So we do have funding in reserve to continue to fund that, but future funding could be affected for the program should we continue this practice of not applying penalties for any period longer than the next 2 months. And in addition, just for members of the public, there are a variety of payment assistance options that they have. We're able to grant 3 of our local nonprofits with fundings for utility rate assistance, whether that be water and sewer here for the city or their utilities with PG&E. So American Veterans First, Assembly of God Church, and St. Vincent de Paul each received a $20,000 grant each. And in addition, through the state, Stanislaus County has enacted their emergency rental assistance program. And although it states rental, that does also go towards utilities as well. And so residents have the ability to be able to apply for funding through that as well. That is the end of my presentation. I'm available for any questions you might have on the 3 options that we have presented to council tonight.
Thank you very much. Maricel, have we seen any abuses?
We have seen residents who have definitely taken advantage of the fact that we are not turning off services. And so they do have outstanding bills. I will say that quite a few of them are taking advantage of the assistance that is out there, because we have received phone calls just to verify balances for them. And the nonprofits and Stanislaus County are being very proactive in that payments are being made directly to the city rather than giving those to the resident and then expecting them to turn around and make payments. So at this point in time, we do see residents being proactive, but yes, we do have residents who, since the inception of COVID and since the enactment of the governor's executive order, have not made any payment towards their utilities.
Okay. I'm hoping that they truly need that assistance, because residents of Riverbank are truly honorable. What we need to do is make sure that we have some type of verification. If they're not paying, they can't pay, and get them into the assistance. I am of the opinion that maybe not this turnaround, but in the next turnaround, we start demanding the payment as we have in the past. The vaccine is now at what, 24% of the county. By the time we get to 1 July, we should be at 60 to 80%, which is more than herd immunity if they want it. If they don't want the vaccine, then there's a, anyway, although I like to continue deferring, it's going to have to come to an end, because we need to start making all of our utilities whole.
This is Councilmember Martinez. I would like to extend our what we're doing right now to the end of the second quarter, but I would also like to say that we should list the agencies that are available to assist. And I think that should go out with our next billing cycle to our residents, so that they know that there is assistance out there. Maybe some people are not even aware that there is assistance. And of course, we need to do it in both languages, so that people have the opportunity to get caught up. And I think that if we send out the notice of the agencies that are available, and then maybe before the end of the second quarter or somewhere along the line, we need to say that, we're going to start adding the penalties. We need to tell people up front what's going to happen, that we're going to go back into our regular normal cycle of, adding penalties. I think we need to make people aware of that before we just do it.
Thank you, Darlene. That's what I was trying to say, but you said it clearly.
Councilmember Cal Campbell, I agree with what Darlene Barbara Martinez just said. Thank you.
Vice Mayor Uribe here. So thank you, staff, for putting together this slide with all the available resources. So I'm in favor for the preventative measure of waiving it for one more cycle, or even delaying the due date if that gives enough time for this information to get out to our residents. So I would be open to both of those options there. Thank you.
You mentioned that it affects our other general assistance program by not taking penalties. Is it significant how it affects it?
So as I mentioned, we were lucky that in the first 2 years, we didn't have many residents who applied. So we did build up a reserve to be able to continue funding that. So right now, the approximate cost for the rate assistance program per year is about $25,000. So the penalties that we accrued were significantly more than that. So we probably have, a good couple months worth to be able to continue to fund that. But in the future, should council decide that we were going to continue this practice to waive penalties, then future applicants we may have to deny just due to lack of funding.
I agree with what Councilmember Barbara Martinez mentioned about keeping up to date and letting people know about the nonprofits that are able to help otherwise. Do you know if there's a correlation between people who need rental assistance and utility assistance? Do you know?
So we're not sure on that information but typically you would assume that they would need both. If they were severely impacted by COVID, then the fact that there's a moratorium on being able to do evictions, as well as a moratorium on being able to do water shutoffs, would probably go hand in hand for some residents.
Mm-hmm.
Councilmember Hernandez, that's actually a really good question. It is something that, depending on how the council decides to create a spending plan for this new round of stimulus coming, potentially there could be programs we could start that pick up the slack where some of this funding runs out for other nonprofits. In the meantime, we could probably ask that question and get generalized responses back. Hey, are most of your clients, are they needing both rental and utility assistance, or is it one or the other? We could get some general information for you on that.
Thank you. And yeah, I mean, if we didn't have to charge at all, it'd be great. I know sometimes it's an equity issue. So thanks, Marisana.
Okay, thank you very much. Not charging at all, though, puts a burden on others who cannot pay either. So, I was going to state with the new stimulus package, we can develop a plan, but I think that was just taken away from me by the city manager. I would like to continue, like Darlene said, Councilmember Barbara Martinez stated that we should continue what we're doing, but we need to make it aware that we'll do all we can as a city, but we still have to make our utilities whole. And how we do that is what we do with the new stimulus package money, how we help those that need it. We're neglecting right now in our conversation the businesses, especially small businesses. With this new stimulus package, California cannot help small businesses according to the rules of getting the money. We want the money. We want to help the small businesses. We can't give them a tax break. California, if you read Adam Gray's latest email, it is almost damning the way the people in power today have just said, we don't really want to help the small businesses, but give it to the larger business. I am disappointed, but we have to develop a plan with the, what is it, 2 bouts of $2.3 million each year, starting this year and next, and our reporting and how we can state how we're using it. Everyone has gotten to speak on this. Is there any public comment, Annabelle?
I believe Sean was trying to say something first.
He's not public. He doesn't get to speak anymore. Go ahead, Sean.
Yeah, maybe just one suggestion for the council to consider. I think Councilor Barbara Martinez sort of said this, but I just want to be clear. If we go ahead and don't apply penalties until the end of the second quarter, would council be comfortable with staff messaging out to the community between now and that deadline that this is the last, for now at least, this is the last extension of the no penalty cycle that this council anticipates doing, and so prepare that effective, the billing period, I guess, of July and August, that penalties will be reinitiated during those months, just so they get like a couple of months notice that this is coming, and that way maybe we don't have to bring it back to you again.
I am never comfortable with saying no. Never. I am comfortable with saying consideration or as we move forward. I cannot ever say no, because when I say no, I have to stick to no. And as a person that sticks to his word, I'm very careful about how I send the message. For the council, I would recommend that we say strongly consider, or that we anticipate something like that, Sean, but never say no, because when you have to back up, then you are showing a sign that you can't make the proper decision.
So we could frame it in a way that, the city council anticipates, and we could put something on consent or for discussion for you.
Very, very good. Anticipate is a good word. Anybody else disagree or agree?
I agree with that.
I agree too. I think by saying at the end of the second quarter gives us enough time to get the announcement out so that people understand we must continue with city business, and so I think the end of the second quarter is good.
Plenty of time to push out those resources too, so I agree.
And Sean, I agree that we need to start putting out the business of the city as we move forward in our communication. We have done a great job, and we need to push that out, but we need to start contracting what we have available to the citizens, and that we're going to have to rely more on other opportunities.
And just to put it into context for all of the city council, if the council were to consider discontinuing this practice for the subsequent billings, the first time we would apply penalties would be in August. So that does give us, quite a bit of time between now and then to do some significant PR and pushing out of information on the resources that we have available.
Thank you, Maricela.
Right, and I think also that it will give us enough time so that if we get new funding or since we are getting new funding, maybe there's a different kind of program that we might want to push out to the residents if we, whenever we get that money, who knows? But, I think we should still consider it.
There's a lot we can do with that new funding, especially to alleviate a lot of future billings for major works if we use it for either 5G, wastewater treatment plant, or some of the other programs that are specific in the bill. But okay, I don't think we need a vote, do we? Annabelle?
Let's go to public comment first, please.
Oh,
There, there is no one wishing to speak, and there were no written comments received for this item. And
no.
yes, we do need a vote since we're talking about handling finances.
Okay, what do we, Maricela,
Yes.
can you tell me what we're voting on?
You, from the sounds of the feedback that we've got from council, you are electing to continue to not apply penalties for the bills which are due on March 31st and on June 1st.
Okay, I'm reading the staff report right now.
So go with option number 3 on the staff report.
Okay, so what we're doing is that we are approving a loss of $60,000. God, I hate that option. Okay, and is there any public, you said there was no public comment.
We just need a motion.
Okay. Do we have a motion for financial impacts of option 1, which is no impact, which I believe was, come on, doing the status quo. 2, delay the due date. 3, do not apply penalties. What is the will of the council?
This is Councilmember Barbara Martinez, and I would like to make a motion that we select not to apply penalties and to extend no penalties to the end of the second quarter.
And that is to accept option 3?
Yes.
Okay.
Vice Mayor Uribe here. I'll second option 3.
We have a motion to approve option 3 by Councilmember Darlene Barbara Martinez and a second by Vice Mayor Uribe. Roll call, please.
Council members, Barbara Martinez,
Yes.
Campbell,
Yes.
Hernandez,
Yes.
Vice Mayor Uribe,
Yes.
Mayor O'Brien.
Yes.
Motion passes 5-0.
Thank you. Item 10.4, local public health COVID-19 update and discussion on ongoing city operations.
I don't have a PowerPoint for this evening because the one that I've been using, I think at this point is fairly tired. What I could share with you, if you've had your eyes on the news just the last couple days, last week, as a result of some pretty complicated metrics. It didn't, in the beginning, the metrics were not that complicated, and now there are a variety of subcategories that can get you into the red tier, even if you have a case rate above a certain number. In any event, roughly a week ago, the county was placed in, met the metrics for the red tier. Effective today, the state California Department of Public Health has updated their website, and we are now formally in the red tier, which means a number of things. Restaurants can reopen at some reduced capacity. Theaters and a number of other businesses that have previously been shuttered can open at reduced or amended capacities. As Maricela mentioned earlier, the rollout of the vaccine is improving week by week here. We're hearing better and better feedback on that process. Our allocations are increasing. So in general, we've moved in overall positive direction. If there's some, and I'll be happy to didn't have it for this report, but I will send around a chart that the county public health officer shared at the board meeting yesterday, which showed how Riverbank is doing in relation to the other incorporated communities. And actually, it was fairly positive. I believe we were, in terms of some of the metrics, we were in second or third place amongst all 9 cities. And there were some communities that had a little variation over the last couple of weeks, where they actually had seen sort of a slight increase in some areas, or not as quick of a decrease. So overall, very good news for Riverbank. One of the things I just want to, there's no absolute necessity for a decision this evening. Marisol and myself have been working on some general plans for what we understand will be an eventual reopening. The council can direct us to go any number of ways. Generally, if I was providing, sort of conservative advice to the council on this, just trying to be as safe as possible, what I think that we can generally assume is that if based on federal guidance as well as state guidance, if the goal is to try to have as many people vaccinated by the end of May as possible, and it is as widely available as we think it will be, it may be that that is an appropriate timeline for us to start transitioning, opening, and we can do it safely. And we've made a whole host of building changes here. And then, during that time, depending on the availability and ongoing issuance of the vaccine, the council can decide when you think it might be appropriate to slowly start to resume some in-person meetings, even though we know that in our council chambers, that will, at least until we move in through a number of more tiers, that'll mean very few people actually attending the meetings. So what I will say is that in general, barring a couple of complaints here and there, which are very few and far between, we've really been able to manage our customer service needs pretty appropriately. And the council has tackled a variety of very complex issues over a virtual format. So in general, that process has worked okay as well. So I'm just putting it out there for council to discuss if you want to give us a little direction so that Marisol and I can make appropriate, do appropriate research and get back to you. But I wanted to make sure we kept this item in our forefront as things start to change with the virus.
Well, Sean, as we tackle some of these complex issues, I
believe the mayor froze there.
Yeah, Mayor, I think you're frozen. We can't hear you.
Okay, someone else speak.
Okay, Vice Mayor Uribe here. So I think the availability of vaccines should be our timeline. I'm thinking in-person council meetings sometime at the end of June, possibly. And I think we should continue to give the authority to Sean to scale the opening, keeping in mind the safety of staff and our residents.
Okay, am I unmuted? Unfrozen?
Yes, sir.
Okay, my problem is we had complex issues that we discussed, Sean, as you said, but we've had very minimal public input, which is not the norm for Riverbank, and that we may have had, this relationship of a Zoom or whatever has put a barrier with the public. And I think, although we may have to wait until June, but Governor Newsom said everyone's going to be vaccinated in May, so maybe we do May. I think what we do is that two things. Push to get all the council members vaccinated and the staff who would be in the room vaccinated. Under CDC guidance, if you've been vaccinated with both of your shots or with Johnson & Johnson, you can be in the same room, unmasked, within 6 feet, up close and personal. And then we request that the public who wish to participate meet the same guidelines by showing but not having them duplicated of any way their COVID-19 vaccination card. Until such time as that we achieve herd immunity, which could be July or August. There's a golden opportunity coming on up for us to meet the goals of safety within the city. I also want to strongly urge every one of the city employees to get vaccinated. And however we do that, Sean, and if we, I don't think it's authorized yet to give a bonus, but you figure out some way to incentivize a vaccination. And those of the council who have not received a vaccination and would like to, Sean, I'd like you to make arrangements with Golden Valley or whatever to see what they can do, making sure each one of us has been vaccinated so we can get together and disagree face to face.
Okay, that's pretty clear feedback from two members. Any other council members want to add to that?
Oh, go ahead. Go ahead.
Real quick, I asked in a few meetings ago if, our cases were differentiated from the rest of the county, and I don't think we could tell then, but that's great feedback that you gave us today. And I think, and I want to say that is due to how cautious in the efforts from the council and leadership. So I do, as Vice Mayor said, to leave it up to you, Sean, to kind of use your boots on the ground to let us know what's the safest route. And I don't know if anyone else will agree, but I feel that if people do not vaccinate, to ask that people wear masks in-person meetings for the time being.
This is Councilmember Barbara Martinez. So being in the red tier means that our businesses can open up with modifications, okay? So I think that we should be following the CDC guidelines, exactly with what that means. Perhaps there are some, offices that can open. I'm not in a hurry to meet in person just yet. I'm sorry. I'm just not. Maybe as we see that there's more people that have gotten vaccinated, or maybe as we maybe go into another tier, keep climbing. To me, I'm all about the statistics, and with the new strains that are out there, I understand it's not just one strain. There are several new strains. I don't want to get sick, and I don't want to bring the sickness home either. So thank you.
Darlene, the guideline, and to all the council, the guidelines are, if you have been vaccinated for the 2 shots or 1 for Johnson & Johnson, and you go to a house, a meeting, a council chamber, that everyone else has been vaccinated, no mask, no social distancing is required. So if we get to that point, I think we need to reconvene. And I also need to make sure that the public understands that if they're in the same situation, they can come and join us at the council meetings. Now, if we need a hybrid, let's say, Darlene, I understand your hesitance, and I also understand the need for not bringing it back home. But you have a business that you run. You're probably interacting with customers that may or may not meet the criteria that we are going to impose. But if you decide I need to remain aside, if everyone remains aside, except for me, I want to go out there and be the pretty face of Riverbank, then I think that we should have some type of hybrid where we do a Zoom and council chamber at the same time. And is that something that can be done? I know it can be, but I'm asking that of Sean and especially Norma, who we put all of these burdens on.
I think we're going to have to look into that. It certainly can be done, and if that's what's necessary to phase in over the summer, where there's a will, there's a way. We'll figure it out. But what I'm kind of hearing in general is I think I have the overall flavor from the council. What I think I'll do is we'll monitor the vaccine distribution. We'll watch the data like we do each week. And at future meetings, if it's starting to really shift and we're now out of red presumably and into orange or whatever other variety of colors they have, and moving in a positive direction, next time you see this item, it will be accompanied with an actual schedule proposed for you to consider.
And Sean, if you can take a look at what we need to do to authorize in the future. Let's say I'm on travel, you're on travel, Darlene, anybody else is on travel, that we can't incorporate what we have here in the future, where we could have a virtual meeting anywhere if we're at, what is it now, Cal Cities, or the any other meeting that we're at, that can we have this type of a meeting with the public as we are traveling?
Mayor, if I could comment, there are currently 3 bills being considered for the Brown Act. So that is pretty much going to dictate what we do in the future. So right now we have the executive order that's a mandate, but depending on these bills, they're going to tell us whether we just go to council or whether we're going to do a hybrid or whether we're going to do other additives to make it more public. Because the public is saying that they do like the virtual connection. There are a lot of people who love the technology, and there's the other group that likes to be in person. So it might be a hybrid situation, but the Brown Act will dictate what we do. Thank you.
Thank you on that, Annabelle. I do know of one bill that was suppressing it. We'll see what happens in the future.
Yes.
Attorney, you have something to say? Tom?
I was just going to say that among those, we're probably going to have Zoom or some type of that technology with us forever, both for council participation and public participation is the word I'm getting.
All right.
I think I have plenty.
All right.
Direction unless there's other comments.
Any more council comments before we go to the public? None. Annabelle, are there any public comments?
There is no one wishing to speak, and there were no written comments received, Mayor.
Okay, Annabelle, my opinion, we don't need a vote. Do we need a vote?
No, you do not.
All right.
Thank you.
Thank you very much, Annabelle. Next one is my anticipated 10.5 approval to reopen recreation programs and outdoor facility reservations. Sean?
Yes, thank you, Mayor. I'm actually going to toss this one to Sue. It does dovetail nicely from our last conversation, but Sue and her staff have worked very hard to really think through how we can restart a number of the programs that they had put on hold, for quite some time. And I think that it's fair to say that there has been no department that has taken a harder hit than Rec has this year, just with regard to their normal operations. And so she's done a really good job of trying to think through how she can restart a number of her programs in a safe manner. And it's even more possible now that we finally are in the red tier. So I'll just let her step through those with you and get some direction.
Okay. Trying to share my screen here.
Now, while you're doing that, Sue, several things I always hear. Can you hear me? Can you see my
Yes.
screen? Can you? No, I'm kidding. Just keep going.
Okay. Hang on, I got to get my PowerPoint. I thought it was there.
We can see it right there.
Is this it right here?
No, down 4, down. It's on your list. Up,
Up. I think I almost had it.
there it is.
Got it. Why is that not working?
So now it's
Oh, that's not a PowerPoint, is it? It's the first one. Very
There it is.
first
I got it. Okay, so then where do I go, Annabelle?
Double click it to open it.
It's not opening
Yeah.
for some reason.
Is it in your 32320 folder? Go down to your folder right.
Here?
Up, there, down, there. Do you have it in there? Okay, yeah, 10.5. Open that one. Is it on the, there you go.
Okay.
Yeah. Yeah, you were, hit that button.
Okay, here we go. Sorry about that. So anyway, what we were hoping, since we see schools opening and things getting a little bit better, we know we need to be very careful, but we wanted to kind of run some things by you and see if maybe we could slowly and carefully start opening up some of our programs. This is the time of year that we really start working on our spring and summer programs. So just kind of wanted to present a few and get the feeling of, are we getting close, and maybe can we get some approval to move forward with some of these. So our Talk Time program, we have 2 more sessions left. We usually run that program year round. We have 2 4-week sessions left that we thought maybe we could pull off. We normally have 20 kids, and these are 3 to 5-year-olds, but we could open the program with maybe just 10 or 12 and finish that off, taking all the precautions that, we should take and everything. So that's one of them that we wanted to try to do. Then we would take the summer break and start that back up in August or September. The other one that we were wanting to try to get back open to some extent is the Teen Center. We were hoping to have a target date of April 12th for that. That program is open just 3 hours a day, and we could limit the capacity. We also could roll up the side doors, so that would have an airflow through the Teen Center. And a lot of the teens like to play on the outside area as well. We can get some activities going there. We just thought it would be really nice for people to be able to get together to some extent, again, in a recreational type of environment. Aquatics and day camps, we really start planning those now, but they really wouldn't start up till June. We do a lot of our lifeguard trainings and things like that in May. So that would start up in June. And when we say aquatics, we mean, you know, the swim lessons, recreational swim, all of the things that we were able to do last summer as well. We were just very, very careful. And then probably about 3 day camps. The other ones that we were kind of hoping to do, maybe movies in the park, spreading people out and just doing one movie in June and maybe one in July out at Jacob Myers Park. The sports complex is still closed for another month because we're still doing the field renovations. But I know that Riverbank Youth Baseball is really hoping to start their practices in April and do their games in May. So they've kind of backed up their season a bit, but we have a meeting with them tomorrow. We were hoping to have some answers for them. I do know they're taking registrations. So we were hoping to have a target date of being at least able to approve some things coming up in the next week or so. Park reservations, we'd really like to get that system back in place because people are coming out to the parks anyway, and it's a lot easier to manage when we know they're coming and we can set some protocols. Also, when we charge for the reservations, that's what pays our park aides to go out and maintain the areas. So it's important to get that system back as soon as we can, and even if we reduce the capacity. So those are the ones that we wanted to try. What we were thinking is coming back later when things are further along and looking at things, more of the indoor type of things, like our gymnasium opening. We have a lot of basketball and volleyball players that are calling us daily, just hoping that we'll be able to open those up. We know those are probably going to have to come later because they're indoors. The community center, Scout Hall rentals, same thing. And the larger special events that we'd love to do, but we know we're probably not ready yet for things like concerts in the park that would draw a lot of people. But I just wanted to get council's input. Is it okay maybe to start moving forward with some of these programs, or is it too early? Just kind of getting some ideas so that we can know what we're doing in the next few months. So I'm just open to any comments or questions.
So the way California is doing this is that they are saying no if you're in purple tier, no with modifications. Then they caveat everything. They said unless you have social distancing, mask, whatever. If you take a look at the Sean, did you forward what I gave you to Sue? Yes, okay. So you have the guideline. The guidelines, and I'm doing it as a nonprofit, and I'm saying that we can do everything as long as we follow the guidelines. And if there are questions, we go directly to Dr. V and she'll just say, well, if you're following the guidelines, you got it. I'm opening up Miracle League. And Miracle League is baseball with 40 people on the field at a time. And you have softball. Softball's allowed, but not baseball. I don't understand that one. Unless you follow certain things. And a lot of it, the little leagues, you have to put the guidelines out there as the California CDC says that, you know, you can't have family groups commingling. My family would have a hell of a time commingling anyway. But then you have in the dugout, mask, and what have you. So there are guidelines out there, and we're not going to be in the purple tier for much longer. We'll probably move to the red tier, most likely to the orange tier by the time you open up a lot of your sports. But always be cautious when you open any sport up, making sure that mask, social distancing, the guidelines provided are adhered to with caveats. You're the Parks and Recs director. You don't need my guidelines to say what to do. You're the director. You tell me if you're going to cross a line, can I have your support? And that's what I would like to have. Not that you need my support for you to do your job. You do your job well, you do it great. And I think that if you look at what the guidelines are, this is what I'm going to do. I'm going to ask Dr. V and some of the others what to do. Go for it. That's me speaking. If somebody else wants to be more restrictive, we opened parks before parks should have been opened, but I think we should have opened up team sports long before we opened up parks.
Vice Mayor, you're ready here, so I'll chime in. I think if the safety protocols are anything like they were last summer, Sue, I think you did a really great job there. I would feel comfortable starting to open them up. I think there are ways to do these programs in a safe way, and I think the difference is we do have some of our population vaccinated. So in that sense, I am comfortable starting to slowly reopen. And you're in charge, like the mayor said. You take the lead. You're in charge. You know what's right, and if it feels wrong, it probably is. Thanks.
Councilmember Cal Campbell, I'd just like to say, Sue, I've got nothing but faith in what you do with your programs, and I back you 100% on this. I know you'll do the right things with it and follow the guidelines, just like the mayor said. So I'd say let's go for it.
Councilmember Hernandez, I appreciate your presentation and the communication and all of that. And I also trust what your decisions are, and I feel comfortable moving ahead with this modified version.
Sounds really, really great. I'm excited.
This is Councilmember Barbara Martinez. I agree with what everyone has said. I do feel comfortable in knowing that the guidelines, safety guidelines and precautions will be followed. We just need to also just keep in mind that the weather's getting warm. So you know what that means. And then we have Easter holiday coming up too. So and you've been in this for how many years now? So I know that you'll be able to take care of our residents, our visitors, and our city. So thank you.
Great.
Okay, I'm unmuted. Annabelle, are there any public comments for this presentation?
Mayor, there is no one wishing to speak, and we did not receive any written comments on this item.
Okay, so we are not going to vote on you doing your job the way you do it because we appreciate that. Do you want us to vote on anything particular?
No, I think I've got the message and I'm excited. So
I'm glad you're excited.
yeah.
So without any further comment from the council, I'd like to move to 10.6. Subdivision Improvement Agreement, Crossroads West Phase 1. A resolution approving a subdivision improvement agreement for Crossroads West Phase 1 between the City of Riverbank and DMG Development LP, and authorizing the city manager to execute the agreement.
I'm very excited. This is sort of a two-part item. This first item, it will be the first half of your approval, and then the final map at your next meeting will be the second half of your approval for the first phase of Crossroads West. And I'm just going to, typically this is something that we would put on consent in many cases, because you're going to see a lot of these over the next couple months and probably over the next couple of years. But I put this on open session because I just want the opportunity to explain why we're doing a subdivision improvement agreement, because we haven't done them with every subdivision we've done. Sometimes they're not necessary, and there's a reason for that. So just very, very quickly, and then I'll get to the detail, and then council can decide what they want to do here. There are essentially two ways to achieve a final map in California. You get your tentative map approval. The first way is when you receive your tentative map, the city engineer and staff basically give you all of the conditions which are contingent upon you. You have to satisfy them all before you get a final map. And typically those are things like you have to construct the street roads, to city standard, sidewalks, lighting, if there's parks in the project, any other public facilities on and off site that are required in order for the first subdivision to be a truly complete community. And in many cases, the developer will choose, especially in a slower building climate, the developer will choose to complete all of those improvements in advance of requesting a final map. Now, remember, when you get the final map, all of the lots divide up, and then they become the lots that you can sell off for the homes that you're selling. And so in many cases, that's the way that it goes. And so the city doesn't allow the final map to be approved until all of the improvements have met all of the inspection standards, and we've accepted them, and we know that they're done appropriately and correctly. So that's one way to do it. The second way to do it, which is being requested this evening, is sometimes in a more aggressive housing market, it makes sense for a developer to request that the city council grant final map approval in advance of the improvements being done in the subdivision. And sometimes there's a reason for that. Sometimes it's economies of scale because they already have building crews and contractors out on site. And so it's more economical just to do all of that work at once, the private and the public work. There's a variety. Sometimes it's financing related. It really depends. And so our municipal code conceived that this was an option for people, and that there's a way that the city can allow that to occur without any risk to the community of someone bailing out of a job and not completing the improvements to standard. Because once you approve a final map, a lot of the leverage that the city has to ensure that the improvements are done appropriately go away. So the way that the code sort of dictates is that the city manager and city attorney are to negotiate a subdivision improvement agreement, which Tom and I have done. And the hammer in the agreement for the city is that it requires that the developer bond for the improvements in an amount equal to 100% of the estimated costs, in addition to another bond for 50% of the total estimated cost of improvement. So if the improvements are estimated for this first phase subdivision at roughly $3.08 million, so they're having to bond for closer to 4.5 million, and that essentially provides some insurance to the city that if the economy turned and this business went out of business and couldn't complete the subdivision, we would be able to tap those bonds to ensure that they were completed and that you didn't have an unfinished subdivision, basically. So that is what the agreement that you're considering this evening, and it is fairly standard. The city attorney has reviewed it. We have negotiated and reviewed all of the insurance requirements and bonding materials. We won't execute this document until the bonds are received, which my understanding is they'll be sent to us by tomorrow morning. And when those are in hand, the resolution before you gives me authority and Tom the authority to execute this document so that they can move forward with the remainder of their project. I'd be happy to answer any questions you might have.
Questions for Sean? Sean, in the future, will this be at staff level approval?
Unfortunately, the way the code reads, the council has to approve these types of contracts, but I think in the future it's totally appropriate for at least this kind of thing for it to be on consent because it's fairly standard.
Okay. I'm hearing no other comments. Annabelle, is there any public comments to this?
Mayor, there's no one wishing to speak, and there were no written comments received on this item.
Okay, before I ask for a motion, these type of items are usually well discussed by the public. And that's why I think as soon as we get back to normal, we'll get more of the public input. But seeing that we have given the public every opportunity, every avenue to give us an input, is there a motion to approve the resolution as presented?
Councilmember Cal Campbell, I make a motion that we accept item 10.6 as so stated.
I'll second it. Okay, we have a motion by Councilmember Campbell and a second by the mayor for item 10.6. Roll call, please.
Council members Barbara Martinez,
Yes.
Campbell,
Yes.
Hernandez,
Yes.
Vice Mayor Uribe,
Yes.
Mayor O'Brien.
Yes.
Motion passes 5-0.
Item 11.1, staff comments.
Because the meeting's gone a little longer than normal for us, I'm going to keep this very brief. I just wanted to thank, because I think it's important to do regularly, thank three staff in particular, Annabelle, Norma, and Gabby, all of whom spend a lot of time on Mondays and Tuesdays coordinating and running around dealing with a variety of technical issues that you get in commonly with this format. And you know, they do their very best to make sure that it's a professional presentation for the council. In fact, sometimes they even talk to me about making sure that my staff or my PowerPoints are up to snuff. So, and they do an excellent job. And so I just wanted to recognize them. And I don't have any further this evening. Thank you.
Oh, I want to thank you, Sean, and I noticed you didn't have any PowerPoints.
Can I just chime in here for a second?
Yes, you may.
Anyone who hasn't completed their Form 700, please do so. And if you serve on other boards, please contact the clerk because I am getting calls from your boards also that they would like to see your Form 700. Thank you.
Sorry, Annabelle, I have all mine all filled out, ready to go to you.
Thank you.
You can take care of the other people. I don't want to deal with them.
Okay.
Okay. Councilmember Hernandez.
Yeah, so a quick update on Love Riverbank. I have been running into technical difficulties all week, it seems, because I use a Gmail to coordinate Love Riverbank and had a meeting yesterday that did not happen. But I want to give you all an update, a quick update that we're going to move forward with 3 small projects for Love Riverbank. They're called Love Teachers, Love Police, Fire, and Postal, and Love Small Businesses. They're all going to be very easy, and we're going to have, over the course of 3 weeks, the opportunity for residents and everyone to participate. We're still going to push out marketing for it because we're still in the background works of getting everything ready to go. But to give you an insight look, Love Teachers and Police, Fire, and Postal, we are trying to locate storefronts that'll host boxes, and we're raising funds to purchase thank you cards so that people can come by leisurely at their own time and they don't have to gather to sign thank you cards and personalize them for these groups, so we can deliver them on April 24th, which is Love Riverbank's day. And I have more to come, but the meetings are always open to everybody to join, and I'll keep posting you and updating you. The other thing is, I really appreciate you bringing up at the beginning, Mayor, what's happened in Georgia, but also what happened in Colorado. I am working on language to bring forward what seems to be it's going to be a proclamation to put together language around Domestic Violence Awareness Month in April, but also the fact that it intersects with racism and sexism and everything that is just involved in what we're seeing over the last year especially. So more to come on that.
Well, thank you very much. We have done that in the past, and I'm sure this council will be honored to continue what we have forwarded in the past in recognizing what the needs are for racism and all of the other type of violences that are out there. But thank you very much. Councilmember Campbell, please.
Just like to say that there's going to be a meeting for Friends of Jacob Myers Park on Thursday at 5:15 at the park. Let people know about it, encourage them to attend. Sue will be there talking about a lot of things. And I want to wish everybody a happy Easter, because I'm not going to see you before then. It's going to come very early this year. And I'm real pleased that we made it from the purple to the red, because maybe things are going to open up better now, but we still have to watch our social guidelines and be safe. Thank you.
Thank you very much. Councilmember Barbara Martinez.
I just would like to say publicly thank you to Golden Valley Health Center for helping with the vaccinations in the city of Riverbank. And also thank you to Congressman Harder for having an information forum on the American Rescue Plan. And happy Easter to everyone, and thank you.
Thank you. Vice Mayor.
Thank you, Mayor. So I just want to thank Richard Gilton for the tour of the waste management that I did on the 15th, just to kind of clarify where the new MRF system was going to be located. I'm going to be doing a regional 911 dispatch center tour at the end of this month, so I look forward to that tour. And I really am looking forward to this Friday's groundbreaking event where I get to see you guys, the rest of staff and the developers. Just, you know, it's going to be a huge moment for the city, a huge moment for staff. So I look forward to that and seeing you guys. Thank you.
Thank you very much. I'm glad you mentioned that. I was going to, but that is very important. I hope everyone can be there to do the groundbreaking that we've worked so hard for over the last 8 years. I want to remind the staff to keep pressure on Caltrans for our calendar crosswalk. I had a conversation with Caltrans that was not in my liking. We decided to move it on up, and now we're again re-engaging Dennis Agar and his staff. And Sean, I want you to, I know Kathleen's going to do that, but look at for LTF monies for all of our bike and pads that are coming on down. Circulus is moving forward. I think I got an email from David earlier this evening that states that they're moving forward. And I'm hoping to have a ribbon cutting for the entire council in the near future, where we can make it a national event, at least bring in US EPA Region 9, maybe even the Pentagon to come down to take a look at what we're doing with the industrial complex, where we're going in our vision, and hopefully they can be on board and not be not an obstacle, but be a questioning of where we're going. So I would like to invite all of those entities when we move forward with Circulus, Metis, so they know where we're going and have a very supportive role of all the national agencies. With that, we're going to go into closed session on item 12. The public will have a limit of 3 minutes to comment on closed section items as set forth on the agenda prior to us going into closed session. We have one item, 12.1, conference with real property negotiators. Government Code Section 54956.8, property 3300 Stanislaus Street, APN 132-012-024. Negotiator Sean Scully, property negotiator Stanislaus Housing Authority, under negotiation, price, term of payment, or both. Annabelle, are there any public comments?
There is no one wishing to speak, and there were no written comments received for this item.
Thank you very much. The public portion of this meeting is concluded. The City Council and the LRA Board is going into closed session. The report on the closed session item will be reflected in the minutes of this meeting. Anyone interested in receiving what was reported on the item may contact the city clerk by calling 209-863-7198 or email cityclerk@riverbank.org. Thank you for joining us tonight. The regular city council meeting will be, the next city council meeting will be April 13th at 6 p.m. We're now going to adjourn. Thank you and all. Good night. I have to find where I'm going.